So you're treating people with Meniers.
Yes.
First off, what are the symptoms of Meniers, the cluster of symptoms, and how do you treat it, and what are some of the results you're getting?
Sure. Meniers is basically a 4-component diagnosis that's clinically given. You'll have ringing in the ears, you may have some hearing fluctuation, hearing loss, vertigo, and tinnitus, okay? And so usually what happens is doctors will take an MRI and they'll say, nope, we don't have a reason why you have these symptoms. You have Meniers disease. Sorry, there's no cure. This is what life is now, okay? And so what we do in our office is really don't pay attention too much to what people were diagnosed with. But a lot of this are also known TMD or TMJ symptomology.
So in your brain, it's like, what's causing this in the first
Yes,
place?
100%.
And how do we fix that? Okay.
Yeah, and so we do an evaluation, we do treatment, and the vertigo, I don't like to say slam dunk. I think I've said that before.
Okay.
But the vertigo is one of the more easier symptoms to get rid of. The ear fullness is too. Tinnitus is a little rough because there's other things that can cause that. But we're having outstanding results with this. And people are flying from all over the country to the office just to have hope for Meniers disease.
You've had patients that get 80% better, 50% better?
100% better?
Is that right?
Yeah.
And it was because the way their teeth were coming together.
Yes.
So it's the nerves here, like the TMJ joint area? Or is it?
Well, it is, but it's how the bite impacts other parts of the body. So you could accomplish the same thing with a splint, but probably not the same level of correction. Because your splint, or a night guard, is something that comes in and out. And so we have to be, patient compliance is now a problem because let's face it, a 24-year-old who's going out on a date is not going to wear a hunk of plastic in her mouth, right?
Okay.
All right. So when you actually build the therapy into the teeth, the patient's therapeutic 24/7. They eat with it. They eat with their teeth. And we don't have to worry about how much therapy time they're actually getting. So the results tend to be faster.
So the technology you're using, you're hooking them up to technology, and it shows you the uneven bite forces in their mouth, or how?
Absolutely.
Okay.
It shows me what their muscles are doing and what the bite is doing. And we look at other things too, but the therapy is really concentrated on those 2 components.
So with Meniers, you've had patient after patient after patient that those symptoms are reversed.
We've had patient after patient, and so many patients that we've actually published a study on it. So enough to know that this isn't just a random event.
And so for people traveling, you could do like a Zoom style meeting over the phone. People that are close by, they come in, they get a consult. How soon before you think on that first initial consult that you think you can do something for them, that they would be a good candidate?
During the consult. Like that first visit before we ever treat.
Do you ever get excited and go, boy, this is going to be good?
Yes. It happens less and less now because you see such a dramatic change. When you're doing it the first few years, it's incredibly exciting. And it's very rewarding throughout. But, you know, I still get surprises.
Okay.
I still do get surprises.
Yeah,
so we
what
have to temper that with just a little bit of common sense.
Now, what if they say, I've been to the neurologist. They said that, you know, I don't really have a problem right there.
Yeah, well, they all say that.
So most of the people you see have been to a neurologist or an ENT.
Neurologist or an
whatever.
ENT, yeah, absolutely. Or multiple
Because I know more and
doctors.
more neurologists and ENTs are sending people to qualified dentists to take care of this.
Yes, that is absolutely the trend. And good on them for being open-minded enough to think that everything's related. Everything's connected in the body.